There we go. Hi, everyone. Welcome to this morning's session. I'm Dr. Guadati Bredding. I'm former chair of the SAC. Each year we hold these student series on important topics that we want our students to make sure that they know about. So today we're really excited to have our panel here to discuss the Minnesota Conference, implications for current and future learners in neuropsychology. Each of them will introduce themselves. It's going to be interactive, so feel free to chime in. As Dr. Butts mentioned, there are some pieces of paper going around. So if you have questions that you don't feel comfortable asking out loud, feel free to write them down and pass them to the center of the aisles and we'll pick them up. Additionally, the session today is being recorded over Zoom. It will be on the AACN SAC Zoom channel, YouTube channel. Sorry, there aren't Zoom channels, YouTube channels. Okay, so mute. Okay, so without further ado, I'd like to introduce Dr. Whiteside, and then they're each going to introduce themselves. Dr. Whiteside is going to facilitate the panel discussion today.
Thank you.
Thank you, guys.
Thank you, everybody. Welcome. Yes, I'm Doug Whiteside. I am let's see, what am I? I'm past president, yay, of ABSIN, and I'm the training director at the University of Minnesota. And I'm also a member of the steering committee, as are my three esteemed colleagues here. So I wanted to just a couple things. So we are, I talked with Stephanie, and we're going to actually also post this on the ABSIN MDI site. So we want to make it widely available because I think this will have a general interest for trainees. So just want everybody to be aware of the recording. But that's why one reason why if you don't want to ask a question, we have those sheets. If you do want to ask a question, one of the things is the sound does not carry very well in here. I was in the talk just before this, and it's clear we need microphones. So everybody will ask the panel to come up when they're answering a question. If you can speak loudly, I think the easiest thing might be for us just to try and repeat the question. So, oh, hold on a second. Never mind. Stephanie's got a microphone. So if you'd like to ask a question directly, just raise your hand and Stephanie will come around. Otherwise, you can write it on the sheet. So I think that's pretty much it for logistics from our end. So a little bit about myself outside of that. I got my PhD from the University of Nebraska. I did my postdoc at the Albuquerque VA back in the day, and got board certified in 2000. So I'm been around for a while. And about almost 3 years ago, almost 4 years ago, 6 years ago, I had a long time ago, it all fades together as you get older. Because I was ABSIN president-elect, I got asked to serve on the planning commission for the Minnesota Conference, which, as you probably are aware, is an initiative from the ACN Relevance 2050 Committee. And I thought that was awesome. Like I knew we needed to do this. It's been way overdue. So since then, I've been involved in this, first as a planning commission member and then as a steering committee member. And we can give you as much detail or as little detail about the whole process as you guys would like to know. This is really meant to be a process to answer your questions. So we didn't come in with a pre-planned agenda. We do have the proposed competencies up there for your reference, but really just want to make it for you guys. And so what I'm asking each of my colleagues to do is come up and introduce themselves, where they're from, that sort of stuff. And then just tell a brief story about, in some way, why this is important to us or related to us or whatever. So I said I would start and share a little story, which some of the steering committee members have heard, so they're gonna have to suffer through it again. You guys only have to suffer through it once, which is good. So this is a story about my vacation, which my wife and I took 2 weeks ago. And you might be thinking like, oh my God, he's gonna tell us a vacation story. Oh, hurt me. Well, it is relevant, actually. We went to Alabama. And again, you might be asking like, oh, great. Why did you go to Alabama? Actually, we went because we take theme vacations to learn things. And we also like to go to national park sites. And so this time, inspired very much by the Minnesota conference, we decided to try and learn more and go to essentially the center of the civil rights movement. And it was really a pretty amazing trip. I didn't know quite what to expect. And you know, I grew up in the North. I grew up in Northern Illinois, and thought, you know, I knew a bit about the civil rights movement, but I learned, yeah, I really didn't understand the civil rights movement. And that was a humbling experience for me, but very eye-opening, and it actually reframed what we've done with the Minnesota conference in new light for me. So here's a travel tip. If you are ever in Montgomery, Alabama, go to the Legacy Museum. It is an amazing museum. It is in many ways comparable to the Holocaust Museum here in DC, or Yad Vashem in Jerusalem, also Holocaust Museum. It's not a fun museum, but it is an important museum because it tells the story, starting with slavery and going through mass incarceration of what it means to be Black in the United States. And, you know, okay, so one thing I learned, you know, I'd heard of lynchings, right? I mean, we've all heard of that. But, you know, growing up in Northern Illinois, I thought, whoa, you know, that happened a couple times. And, you know, it was not I mean, it was bad. It was a crime. It was covered up, you know, knew that stuff. But I did not know how prevalent it was. It was essentially systematic genocide that was being attempted by the Ku Klux Klan and other members itself. And I'm just like, oh my God. So it was very eye-opening for me. And I think that sort of experience is a good growth experience for all of us, you know, in various ways. So I appreciated that. The other thing that I knew abstractly, but learned more directly just from these experiences, was just the amount of resistance the civil rights movement encountered, right? So, you know, the Montgomery to Selma March, Martin Luther King, you know, we kind of hear about it in the abstract, at least in the North. And so we knew it occurred, but, you know, just to experience it, and kind of, some of these experiences were quite visceral, which I appreciated. And, you know, it occurred to me that, you know, in some ways, the Minnesota conference is a bit of a microcosm of that, because I think, you know, the theme is that whenever you have you know, essentially a societal level change occurring, you're going to get pushback. You're going to get people who are saying like, no, the status quo is just fine. You know, in the South, it was, you know, segregation, you know, with whites on the top. And so you're going to get pushed back. And now the civil rights movement, they dealt with violent resistance. We haven't dealt with that in neuropsychology, but I can tell you, you know, that, you know, my experience of the resistance that we expected, and I'll be honest, we didn't think we would be quite this strong an emotional reaction, but it was. But I understand a little bit more of the context of that. So anyway, I coming out of that experience, even which was more than what I thought, I now see how important this is for our field and how we move forward. So anyway, that's my story, and I won't bore you more with it. Now it's Veronica's turn. So I'd like to introduce my colleague, Veronica Egger-Bordas, and she's going to introduce herself.
Thank you. Okay, I'm always very short, so I have to like be on the side here so you can actually see me. No, you're good.
Okay.
Oh, well, yes, here we go. Not I get swallowed up by these lovely podiums. So hi, I'm Veronica Bordas-Edgar, and the two last name thing throws people off. That's okay. I am. Yes, it's okay. No worries. So I got my PhD actually in counseling psychology at Arizona State University, and then I trained at Boston Children's Hospital, and then I did my fellowship at the University of Minnesota Medical Center. I'm currently at UT Southwestern Medical Center in Dallas. I'm a pediatric neuropsychologist, and I am at Children's Health in Dallas. So I'll kind of back into the I guess the way that I got on to, my involvement with Minnesota was similar to Doug. I was asked to be on the Planning Commission. I was the president of the Hispanic Neuropsychological Society, or HNS, at the time, and also on the Cultural Neuropsychology Council. And so I've been very involved in HNS for a really long time, which is kind of how I got my foot in the door with neuropsychology. And it's a story for another time for those of you who are interested. But certainly, currently, I'm also the president-elect of the American Board of Clinical Neuropsychology, so we're really passionate about kind of these training guidelines and how this is going to move our field forward. So on the Planning Commission, I was co-chair with my colleague, Dr. Stringer, of the Delegate Selection Committee. And that was a difficult committee because, as you can imagine, we were really trying to change kind of the makeup compared to the Houston conference of who represented neuropsychology, right? And we really wanted to have, targets that we actually hit in terms of expanding diversity. And so, having kind of a broad representation. So, I know, very proud that we were able to accomplish that. Even after we reviewed a lot of applications across the board. So then I was voted in to be on the steering committee by the Cultural Neuropsychology Council to represent them as one of the 3 steering committee members to represent cultural neuropsychology. So very, very proud to do that. And kind of the story, I guess I would share along the way that might resonate with some of you is, I grew up, as an immigrant, immigrated to the United States. So we didn't speak English at home. We spoke mostly in Spanish. And so if you can imagine standardized testing, and standardized testing to get into graduate schools and other schools is very difficult, especially on vocabulary, not so much math. But so there's a lot of discrepancies in my profiles. And so because of that, I wasn't supposed to get into graduate school. And then I wasn't supposed to get an internship. And these are the messages that I was being told. And then I wasn't supposed to get board certified. And then I just told you I'm president-elect. So, those are, I think, messages that we hear from people along the way, and they just kind of can spur us on. So just really excited to be part of this, movement, and lots of reactions. I did a lot of deleting and not reading for my own self-care. And I've been on vacation for 2 weeks leading up to this. I'm a little jet lagged, but otherwise, and I did not check my email. So you have permission to do that when you go on vacation. So I will turn it over to my colleague, Dr. Penna.
Hi, everybody. I'm Suzanne Penna, and I clearly need to get closer to the microphone. Better? Okay. So I'm Suzanne Penna. I am currently the training director at Emory University. Actually, no, I'm not. Now I'm the division director. I am no longer the training director because my colleague, Tony Stringer, decided to retire on me, and I get to fill in his shoes. So thanks for that. Anyway, I am also a member of the steering committee, as are my colleagues here. I started this process again as a member of the Planning Commission. I was on the boring side of the Planning Commission as part of the Logistics and Finance Committee, which is just as exciting as it sounds. So it was mostly behind the scenes kind of thing. But you know what? In order to make something like this possible, you need a lot of details and plannings. I kind of consider myself the psychometrist of the event. It's like I was the one getting the data. In terms of my involvement with the steering committee, I am the current president of the, thank you, Association for Internship Training in Clinical Neuropsychology. I am the treasurer of ABSIN, so the Association for Postdoctoral Training in Clinical Neuropsychology. At Emory, we have a very large training program. We have a practicum site that takes students from 4 local schools. We have an internship program with 4 interns, and we have a fellowship program, an ABSIN fellowship program with 2 to 3 fellows. So I do a lot of training. I see myself professionally as somebody who is really sort of both top down and bottom up a teacher. I am invested in sort of the future of neuropsychology. I'm invested in students. And what I have seen is I became a neuropsychologist almost out of luck. I didn't know neuropsychology existed until I got to graduate school, which by, many standards is too late, given sort of how the field is right now. My dissertation was not on a neuropsych topic. It was on depression. And I managed to get board certified, and I managed to sort of, get where I am in this profession because I got lucky and because I had mentors and because of mostly that type of thing. And I feel like there should be more than luck involved. If people come to this late, if people have non-traditional backgrounds, if people live in places where there isn't neuropsych. Some of the most brilliant students I've had come from backgrounds that are not the standard academic model. So I think that's really what I want to balance. I want to balance sort of, rigorous training, protection of the public with being able to open doors where they haven't really been opened before. So I think that was really my impetus in this, is really kind of thinking of how can I support the next generation of neuropsychologists be successful? Not really an exciting story, but that's where I'm at.
Well, welcome everyone. Thanks for being here this morning. My name is Kathleen Fuchs. I'm currently at the University of Virginia, and I'm the director of postdoctoral fellowship there for a few more months till my colleague comes back from maternity leave. So like everybody else, I started on this journey for the Minnesota conference being on the planning commission, and I was on the planning commission by virtue of being president of the American Board of Clinical Neuropsychology at the time. So excited that Veronica will be stepping into that role in a couple of years. And the thing that really connects me to Minnesota is I was a graduate student in Houston at the time of the Houston Conference guidelines. So I had sort of a semi front row seat as to what was going on. And you think there's controversy now? Whew, it was pretty bad then. So my mentor, Julia Hanna, kind of spearheaded that conference initiative. And I had so wanted to be a scribe for that. We had our graduate students and fellows as scribes. And she didn't let me because I wasn't done with my thesis. And then, because if any of you have ever met Julia Hanna, she used to walk around in her cowboy boots, and she kicked me in the butt with her boots and told me to get to work. So I got it done. So I do recall from that time looking at who was there in the room where it happened, and it wasn't any of you people, not at all. No trainees except for the scribes, very few people of color, a lot of people of privilege, and also senior in the field, which there's a role for people senior in the field, but as we learned from our time in Minnesota, there is an outsized role for the junior people in the field, the people for whom this is for. So our guidelines here, you've gone through your training or going through them, they're for the people you're going to train. And so this is important for us to really understand these competencies, refine them, embrace them, so that we all agree on what it is that we're doing and who we're going to be as neuropsychologists as we go forward in the field. For me, where I practice now in Virginia, just a couple miles down the road, this is all very important. All the EGI work that we did in Minnesota, really relevant to my practice. If you were there yesterday, I explained a little bit about what Charlottesville is about. The university where I practice was built by Thomas Jefferson. Well, he didn't build it. You know who built it? Were the slave laborers. So we have an enslaver who is this revered person in our community. We still have the trickle down from that in our community. I went on an architectural tour of the university that's very different than what they give the incoming students. And it talks about how it was designed to hide the shame of what was going on there. It was a really powerful tour. I will also say that Virginia was a state where there was resistance to the Brown v. Board of Education ruling that desegregated schools. The governor shut schools down rather than desegregate. And so I have a whole population of people that I see who are native to Virginia whose education was fundamentally disrupted for a time, who were in segregated schools beforehand. And then when they desegregated, it's not like it was a picnic either. So they were under stress in school. And I have to really think about that when I see these people for an evaluation. The other thing that is interesting about Charlottesville is we're a relocation center for the International Rescue Committee. We have a lot of new arrivals in the United States who are really trying to make a new life for themselves. And so we see them in our clinics. And a lot of times we see them because they need a waiver for a citizenship exam because they're having trouble learning English. Go figure, you're 70 years old and never worked outside the home and have no education. And now we expect you to learn English and take this test in English. So they're struggling. And so we're working on how to provide services to them, not just to get this piece of paper, but to allow them to really make themselves at home in our community. So this is important to me because we don't practice in a vacuum. We practice for a community that is changing before our eyes. And I just am so grateful to all of you for being here today and wanting to learn about all of this. So thank you.
All right. Again, thank you, everybody. So that's a little bit about us. Yep, microphone. Here we go. If you can't hear us, just raise your hand and we'll adjust things. So I'm going to do that so the people who are watching this on video don't have to just watch my neck. All right, that's better. So I'm just curious, first off, how many of you attended the session yesterday morning? Just to have some sense of that. Okay, so maybe half-ish. Okay. Because that covered a lot of the sort of fundamentals of where we came from, what we're trying to do, what our goals are. You know, we didn't go into a lot of details on what the guidelines are specifically because, you know, it's a work in progress, but these are the proposed functional and foundational competencies that are up on the board, which we'll just put up there basically for your reference. And as a brief review, a lot of the, you know, kind of basic competencies are still there, you know, integration of science and practice, assessment, and so on. We have added some new ones. Noteworthy is the advocacy and the technology one. And as I said from before, it's clear why we need technology. That's pretty clear. I would say it's also probably pretty clear to most of us why we need a strong well-integrated EJI competency. Other competencies, it may not be as clear, but what we thought we would do is, because this is for you guys, is instead of like doing another didactic talk, we wanted to make this informal and discussion, and we'd like to hear from you with questions you have or your own thoughts on it. Like I think it's helpful. You know, we've heard feedback from some segments of our field, loud and clear. I would say personally, we have not heard a lot from folks who are still involved in training or maybe just recently graduated. So we'd be interested in that as well. But really, we thought we would let you guys guide this discussion. You can ask questions either through the cards or just stand up. And what we'll kind of do, I think, is take turns answering questions. And if no one jumps up to answer a question, I'll just volunteer them. It'll be fine. So how does that sound? Okay. All right. Does anybody want to start? Alyssa, do you want to?
Yeah, and I'll come through and grab some cards, but maybe just to make sure that, so we have various learners at different stages here. Can somebody provide a nice kind of foundational, bringing everybody to the same kind of place in terms of what are the main kind of goals for why the Minnesota conference guidelines are even being created. What is the difference between the Houston conference guidelines that we may have more familiarity with, and why are you working on the Minnesota conference guidelines, and what are the main changes, just to make sure that we are all kind of at that level.
Yeah.
Foundational.
So that's an excellent question to start, because let me so basically Alyssa's asking why did we do this? What was the need for it? Why do we need it now? And it's an excellent question. We could probably spend the next hour and a half on that. We won't, but it looked like everybody was pointing at Kathleen to answer that question. Oh, are we pointing at Suzanne? We're pointing at Suzanne. No, we're gonna let Kathleen do it, but the rest of us can jump in too, because it's an interesting story.
Okay, so one of the main reasons we're doing it is, for one thing, those guidelines are 25 years old. The world looked very different 25 years ago. Our practices were very different, and the guidelines are solid. We're keeping a lot of what was there because it served our profession well, but they weren't enough for our changing world. And so that was the main impetus. And this came out of the Relevance 2050 initiative through AACN to look at how we are serving our current and future populations, our communities, so to say. So one of the things that, as those guidelines were reviewed, is we realized we really didn't put in the core of how we train about equity, justice, and inclusion, because that is part of the context in which a brain functions. So it's important to have those understandings, to know how our instruments interface with people, even not just like norms for certain groups, but really what are the task demands, and do these disenfranchise or unfairly are they unfairly biased against certain folks? We need to look at that. We need to understand that. So that's part of it. Also, the technology in our world has exploded. And if you were in the talk yesterday and you heard Bob Builder's talk, it was like, oh my gosh, there's so much out there that we could really be harnessing, not just technology, but data analytic methods. And so we need people to be fluent in those going forward into the future, to be competent professionals. And then also just to look at the way we train. So the whole shift of the Minnesota guidelines was to a competency-based model. And so that these that we have in here, these are the competencies that are going to be at the core of how we train. And then within that, we have elements underneath those as to what we're talking about. So it's a shift to bring us forward to the future. And again, it's for you guys. So that answer the question. Anybody else? Suzanne, you want to fix my answer now?
No, I think it's fantastic. Again, because I tend to be the logistics kind of person. So we have not eliminated anything from Minnesota. I mean, from Houston, we have only added. So everything that was there before is still there. I think the additions again are the equity, justice, cultural respect and inclusion, advocacy, technology, and innovation. Those are the three additions. Everything else exactly the same. I think something that is hard for people is, again, this shift to a competency-based approach. So what the Houston conference gave us were clear guidelines. You need X number of courses in this, you need to do X number of years in this, things need to be focused, so it was list-based, very prescriptive. That's not the way that APA measures things anymore. And so what they measure is outcomes. Are you competent in doing X, Y, or Z? So the how you got there is less emphasized, and are you able to do it? That's where the emphasis is now. And I think honestly, as neuropsychologists, this is a lot of what people struggle with, because you're like, well, how do you define that? How do you measure that? Because that's what we do. We quantify, we measure. And we have an implementation committee that is coming up with ways to try to offer suggestions to people in order to achieve these competencies. But the competencies themselves, that is what we're trying to decide on now. Are these the things that we want an entry-level neuropsychologist to be able to do? So think about outcome rather than how we get to the outcome. So that's the perspective change.
So yes, as Suzanne mentioned, the competencies are not new. They're used by APA, and they're actually used by your doctoral programs. When we do, as supervisors, when we fill out your rating forms, we're filling them out on competencies. You know, similar when we look at board certification for many years, we've shifted to a competency-based model. So we assess all of these competencies when we're doing and going through that board certification process for folks, right? So I think it's new to, especially to folks who are not directly training individuals and filling out those forms. But the field as a whole has shifted to that competency-based model for a very long time now. It's now just, again, expanding and deepening in neuropsychology. Another question that I think came up was how you can find the draft. So the drafts are, are found on the websites of most organizations, and it'll say kind of like the draft document. So if you're not able to do that, certainly reach out. We have specific at-large members who are also student members, and then also the ANTS student members can also get that to trainees. Next question. Oh,
Well, I would just say,
Oh.
so one place you can find it, it's on the Absen website without having to go into the member only site. So that's one place you could easily find it. So, one thing that may be on your mind. Okay, there we go. One thing that may be on your mind is, and we've alluded to this. This is about the future of our field. I mean, and if you were at the talk yesterday, I mean, it's pretty clear that if we don't do something, we're going to be obsolete in 10, 20, 30 years at max. And, maybe that won't have a big impact on people like me, right? I'll be retired, but, and I'll be joining Tony on, Aruba or wherever. But you guys are going to be working. And so it's important for the future of the field, to do this. And the other part is, this probably won't directly impact most of your training, because you're in training. Like, I'm curious, like, what level is everybody here? Who's a graduate student? Okay, who's an intern right now? Okay, and who's a postdoc? Okay, so, I'm sorry? Oh, anyone in undergrad or not in grad school? Oh, hey, all right. That's awesome. That's awesome. So, this is moving forward into the future, right? So, the impact on you will be less directly in your own training, but more how you train the next generation. You'll become the trainers at some point. Many of you will, and it'll be important to have these competencies well established, so that you can then take the next generation and they can go after that, and continue to build the field. We do need to do a better job of serving a lot of different types of folks. We need to do a better job of integrating technology. There's a lot of ways this will help. It's not the end of the road by any means, but this is, it's really about the future of the field. And what we want to do, I mean, and just honestly is engage with you folks, because we'll be doing some of the training, but I think the vast majority of training in this model is right here with you guys. You're going to be training those folks for many, many more years than any of us on this panel, particularly me. But think of it from that framework. Okay. So other questions?
Just what you were speaking to, which is kind of the timeline here. Are these going to go into effect this year? 5 years? 10 years? So
No,
what
that's an
is
easy
that,
one.
right? So what is the projected timeline of when you anticipate these may start? And what does it mean for the learners that are in training now? Is that going to alter their course as they're finishing their training? Is it going to impact their board certification goal and kind of what they have to accomplish for board certification? Can you speak to some of those topics, please?
Sure, I can start and then we can all kind of jump in. I think if we look back at history at what happened with the Houston conference, that wasn't immediately adopted. There wasn't like this dramatic overnight change once the Houston conference was adopted. And it wasn't adopted immediately by everybody. That took a process of, I don't know, a couple of years at least, and probably actually continued on for many more years. And so we anticipate the same thing. The process for approving these is still going on. We're going to have a meeting in July. And so there's a process here that will last several more months, then they'll be published. But even then, to get them adopted by the field will take more time. And even once, say, for example, ABCN says, yes, these are good to go. It's not like they're going to say, okay, everybody, you have to pass exams based on this new training guideline. They'll, in all likelihood, just as there was with Houston, there'll be some grandfathering. So depending upon when you train, there may be somewhat different requirements. I mean, there's a lot of this still to work out. We don't even have an implementation plan yet, but we're working on that. So I would anticipate this to be a multi-year project. But if that gives you some sense, we don't have like exact dates for any of this, but at least to give you some idea that we're talking about something that's not going to roll out in July and be implemented in August, and by September you're going to be doing something different. No, nothing like that. But like I said a moment ago, it's more about you starting to think about how you will train people someday when you are in our roles. Okay. I don't know. Does anybody else want to add anything okay. All right. We're good. Dr. Stringer, the esteemed Dr. Stringer. So in all seriousness, Tony Stringer has done more to make this real than
what is this?
Oh my God.
She's already married. Yeah, I was going to say, I mean, the formal adoption of these guidelines is really going to be, truthfully, university by university. Yeah, I think there'll be programs that continue to follow Houston Conference guidelines, and then at some point they will say they've adopted the Minnesota guidelines. The AACN board has just decided at the most recent board meeting that they will not adopt the guidelines until they are in published form in a journal. And that is when they will consider them. So it's going to be organization by organization. And I can say, like, in terms of board certification, the Houston Conference guidelines, their adoption and the specific criteria that are used is based on date of graduation, from a doctoral program. So even after adoption, there will be a long period of time where, you may be following earlier criteria just based upon when you earned your degree. So this is not even going to be overnight. It's not going to be even like over a decade. I mean, we're talking a really long adoption period.
Yeah. Just to elaborate on that, just one point is one of the issues with the original Houston conference is we waited 26 years. That was a bit long. So we actually have part of our plan is to revisit this every decade to make modifications, because we know society will continue to change, technology will continue to change, and we don't know, we can't predict what the future is. So we kind of picture this as more of an ongoing evolutionary process that will make our field more responsive to whatever changes are going on, because waiting 26 years was too long. So this, there's going to be a time to ramp up and adopt this over a period, but and then there'll be a continuing evolution of that.
Yes.
Faculty member. First I want to thank you guys. There's so much work that I know goes into putting these guidelines together, and you guys have been really thoughtful and careful, and it's really easy for people on the outside to say, oh, you could have done this or that differently, but you guys have a really hard task ahead of you. One of the things just in looking at them that I wonder about is like 13 competencies. And I think about myself as like a professional neuropsychologist and how hard it is to think about any colleague that I know that's like equally competent in technology and advocacy and assessment and mentoring and supervision, and whether or not these competencies are realistic expectations to be putting on our future generations, that they could do everything all at once during 2 years of training, and whether or not thinking about like tracks where if somebody is really interested in advocacy, or if someone's really interested in clinical care, or if someone's really interested in technology, where the expectations for competency might be different depending on what your individual interests would be, instead of telling everyone who's coming through that we kind of expect you to be equally proficient in all areas. Does that make sense?
Yes, we expect you to be equally proficient in all areas and outstanding and leading the field. No, all kidding aside, I do appreciate that question, because that has come up as to how are we going to do all of this. And I want to remind everybody, this is where the end point is, where you get this competency. You've got your training all along to start building upon these things. So it's not just, oh my gosh, 2 years, I've got to cover all of this. And you are correct, depending on where you're training, what the resources are that are available to you, you may be focusing on some competencies more than others. But we don't want to graduate people who have no technological ability, for example. So it's not like you're going to have to be the stellar person at the top for that, but you need to have some sort of understanding and fluency with it. And it's possible to get that in conjunction with some of the other competencies. So does that alleviate any anxiety at all? I hope.
What professionals in our field look like, right? And you know, I think having a core level that's, you know, worth thinking about. But do every neuropsychologist I know who's already gone through training have all of these competencies, and could they adequately supervise somebody in advocacy and technology?
Can you join our committee? I really appreciate your thoughts on this. So it's like, again, with all of these core competencies, do people out practicing now have them? How are we going to maintain this? Right, that's part of what we're looking into in the implementation phase of all of this. Because you're correct, there's going to have to be a lot of continuing education for people already out on the field, in the field, who are then going to be training on these. And this is, as Dr. Stringer mentioned, we're going to have a roll in for different organizations adopting these, different programs adopting these, and so on. And again, for board certification, we're going to have a long tail for Houston on there. But at least everybody will now know where we're heading, and that's important.
Again, I'm going to try to provide the more granular detail perspective. So for some of these, you know, you look at these, you're like, gosh, this is daunting. But again, minimum level competencies. So for example, let's say you are primarily a clinician and you're like, I don't do a lot of advocacy work, but somebody give the example, do you fight for your patients? Do you say like, what, you know, this person needs accommodations that they're not getting and they deserve them because of X, Y, and Z? You're an advocate. So can you do that effectively? That's what this is covering. You're in a PsyD program. You're not research focused. You're not really interested in it. However, can you read neuropsychological literature, understand it, look at its strengths and weaknesses? Do you understand sort of basic statistical analysis? Is this a good paper? You're competent in research. So again, some people are going to go all in on a particular area. So rather than sort of tracks, you know, people just sort of fall into their lane. So for me, I really fall into the training sort of, that's kind of my deep dive. But on, you know, some of these, I'm like, okay, here are things that I'm more or less competent with, but again, minimum competency. So that's kind of what we're thinking of here, and thinking of these in very flexible ways. Does that also help relieve some anxiety?
You have a really nice practical example for advocacy and some other things. Could you give us a really good practical example of minimal competency in technology and innovation, please?
Okay, so the question is about minimal competence in technology. Well, doing a presentation on Zoom when you have an audience. How's that? All right. That, yeah, I mean, seriously, I mean, I'm joking, but 3 years ago, how many of us did it? How many prior to 2020? How many of us did regularly or ever got on Zoom or any other platform? Right? Yeah. How many of us have done that since 2020? Yeah. And some of us have done it a lot. So I think that's an example of a basic thing to learn. That it's simple. It's not like rocket science, right? But it's surprisingly complicated at times. And being familiar and being comfortable with that. Now, I think, and maybe my perception is incorrect, but I think people who grew up with computers, since early childhood are going to have an easier time with this than the people training them. Okay. I have the feeling most people in the audience would have had a much easier time getting set up than we did. Okay. But that being the case, technology continues on. And, I think 20, 30 years down the road, you'll be in our shoes and there'll be a generation or two behind you who has different technologies that they're all familiar with that you're kind of struggling to learn. And it's that sort of fundamental familiarity and comfort with technology, whatever form it may evolve into, that's what we're trying to get at here. So some people may all get into developing, specialized tests using the most advanced technology. That's great, but that's not what these competencies are about. It might be, being familiar enough with technology to use those tests or to use whatever, like whatever may come. Like one of the interesting aspects of Dr. Builder's talk yesterday was like, well, what if we didn't have these artificial tests, but had ways to measure, behavior and cognition in more naturalistic settings? Okay, that's a major sort of zeitgeist change. Okay, what if that happens? What if we develop reliable, valid, culturally sensitive, functional measures like that make our tests obsolete? So it's that sort of like, perspective and ability to learn and adapt to technological innovations. That's really where we're going here. So it's, I joked a little bit about learning how to do Zoom, but it's really more that familiarity and being able to adapt our practices and our training as technology continues to evolve. Oh, yeah, Mary? Yeah. Yeah. So I'll just repeat what Mary said for the people watching on recording. So Mary Fernandez offered up the suggestion or the example of electronic medical records, which is a really good one. And I can tell you, when I started out in training, there was no such thing. We were writing notes in charts, handwritten notes, and we were trying to read other providers' handwritten notes. And however much we might gripe about Epic, believe me, that was far, far worse. And it really was, because there were a lot of issues with medication errors. I mean, oh, did he write 100 milligrams or 100 micrograms? Okay, so those were real issues prior to Epic. So I think that's an excellent example, Mary, of the sort of technological changes that don't just affect neuropsych, but are there. And so that will continue on. And we don't know where it'll go, but that's a good example.
Themselves are in some ways kind of establishing like a privilege of being able to have the opportunity to do those and be able to engage in those. And I think, yeah, just being, I don't know, seeing other students from different regions and knowing that they might have different levels of opportunity and what that might mean in regards to meeting these competencies. And I was just wondering kind of your position on that and in general.
Suzanne's gonna answer this one. Oops, sorry. Oops, sorry.
So to kind of repeat the question, I think there was concerns of these expansion itself is in and of itself a form of privilege that we are adding to the burden that might already be there and the expectation that might already be there for neuropsychologists. And I think it's a very valid point. I think we struggle already with this tension between making sure we are producing competent neuropsychologists and being able to expand the pipeline into the field so that we can get more people involved in the field. So I think you are really exposing the fundamental tension that everybody involved with these guidelines is struggling with. So I don't have a good answer for you. I really don't. I wish I did. I think what we're trying to do is really get creative in ways in which people can achieve these things. You know, we are well aware that there are parts of the country where there literally is no diversity. You know, everybody is white. And that's just the demographics of where you are. But are there things like No Neuropsychology out there? Are there webinars? Are there other ways that we can educate, where we can teach? I mean, even after we're done and the PhD is in hand, aren't we still required to get continuing education credits? Aren't we required to be lifelong learners? So I think the real task here is how do we get there in a way that doesn't further marginalize populations? And I think you do raise an excellent point. And it's a question that I think we will continue to struggle with. But in some ways, the pandemic was really good for the field because it did force us to think outside our traditional academic models, which I think will be a benefit, ultimately.
Yeah, and I would also add, I mean, certainly echo that, but I would also add that some of these competencies also add additional protections actually for our trainees, in the fact that because we are expecting trainers to also have this level of competence. And so it's really elevating everybody and pushing everybody, and hopefully will provide a little bit more protection and support for trainees from multiple backgrounds.
Okay. Was one other, I mean, it really, before we ask the next question, this really is a fundamental implementation question, which, you know, as we've said, is part of this process that we haven't spent a lot of time on. But I can tell you that these sorts of issues have not only been thought about with the Minnesota conference, but I can tell you Absen has thought about this, and, you know, Absen is committed to developing and producing resources to make whatever is needed available to support programs that may not have access to various training opportunities more available. We have the multi-site didactic initiative, No Neuropsychology, and that's using technology, right? To make training more available. We're also developing a practicum level program organization nationally to essentially do the same thing. So this is all really kind of wrapped into the whole notion, and you know, so we're using technology to provide better access and hopefully more equity is our hope for some of these things. So anyway, just one last thought on that.
Can you, Dr. Whiteside, speak a little bit more to maybe the anticipated implementation of this?
Okay.
How are we going to measure these competencies and progress toward competency in these areas? And will it look different based on your stage of training? practicum, internship, fellowship, for example?
Okay, so just to repeat the question, so Melissa is asking about the implementation, how that's going to look, how it's going to be measured, a lot of details about that, and I think I'm going to volunteer Kathleen to answer that question.
Sorry, yeah, thank you for doing that. Sorry, so can you repeat the question again? Seriously, sorry.
Implementation.
Implementation, right. Thank you, that's it, the measuring. Right. So what's really great is we've got some literature out there about measurement and like look for fellows, interns, students, and so on. So I don't think we're going to throw all that out. We're just going to say, how can we use these tools that we've developed and now apply them to what we're asking people to do? And as I said before, this is the end point. When you are done with all the training, you should be competent in these areas. We don't expect you to be at each. And so it'll be up to the different programs to decide, for our interns, this is the level we expect them to hit as they work towards those endpoint competencies. And we don't want to be overly prescriptive in that, actually. We want to allow programs to be creative, and I really hope that they will be. Kind of like what Doug was just talking about with multi-site didactics. I was thinking, wouldn't it be great if we could have exchange programs where fellows or interns could go to a different site? I mean, couldn't really go across the country because, you've already moved enough times. But there could be a way that we could really share and pool our resources in these ways to get people these different experiences. But again, just like now, we expect each program to set their own metrics, but we also expect them to come out with a certain level so that they can move on to the next phase. I hope that answered your question, or whoever posed the question.
Oh, I've got one up here. Yeah.
Okay.
Hi, I kind of have a follow-up to the question and the answer. So I come from a non-traditional background where in Puerto Rico, there are very limited neuropsychologists. They do have good programs, but unfortunately, they have the Houston guidelines. It depends a lot on you as a student. If you want to have that opportunity, you have to get the additional electives. You have to do externships outside of Puerto Rico. So taking into consideration different programs that may not adjust to the Minnesota guidelines completely, how can students like me become successful and maybe be eligible for board certification? What strategies would you guys have for non-traditional students?
Yeah. So the question is, for people coming from non-traditional programs, or I would actually probably even broaden it a bit, because it's not just Puerto Rico. It's like, there are many students who are in programs that don't have neuropsych tracks, that don't have neuropsych emphasis, and we're aware of that. And it's kind of, there are many roads to Rome is really where we're going with this, is that you don't, there's probably what would be an ideal path, whatever that is, but really we want to make this a flexible thing, and Kathleen had spoken to that. And what you may not get at one level, you get at a different level, and so that's actually been something I've thought about personally a great deal as well, which is kind of like why we want to support practicum training. Because honestly, there are sites where you've got like all these resources, and you got didactics, you got postdoc programs, you got wonderful, neuropsych track PhD programs, and life's good. But you also have sites, and I think yours is a good example, but not the only example, where you don't have that, where you don't have these resources. And how do we level that playing field, provide more access to services, provide more opportunities? If you're not in a program that has a neuropsych track with 4 neuropsychologists on faculty and all those sorts of great things. And so, that's part of the ongoing process, but I think we're all there. Yes, Stephanie. Oh, wait, maybe hold on. Yeah. Okay. Veronica's going to add in some more.
Yeah, so I just wanted to add in terms of the kind of the board certification aspect of this. So I'm also the credentials review chair, and we do actually have specific kind of separate guidelines for example, applicants from Canada. We have specific considerations for applicants from other countries. We recently had someone from South America, also Puerto Rico, other places where we know there's not those same experiences. So we actually do look at these things on an individual basis. We also have an email. I get lots of email questions and I do personally respond to them when people are thinking about, hey, what are the other things that I need to round out? Or I'm thinking about this program, that may be a non-traditional postdoc, for example, and what are the things that I need to consider to be able to apply and to be eligible? So, really from an ABCN perspective, our goal is to help you get certified. It's a very collegial, and we want to help fill in those gaps where we can too. So we do actually, all of this is definitely on our radar, but we do, our goal is not to keep people out, but it's to help you get the training that you need to get certified. So that's really our kind of our ultimate goal. So hopefully that helps with some of that, but certainly, we don't exclude people who are from non-traditional backgrounds. Yeah.
It's interesting. I actually had a very similar conversation with Tony Puente a few weeks back about this, because I don't know if you're aware, but I mean, he's very involved with a doctoral program in Puerto Rico. I don't know if it's yours. Okay. But I mean, it's that sort of, the challenges are there, and we've been making some strides, but it's an ongoing process. So, Stephanie, did you have another question?
I actually was, this is not my panel, but I was going to say, I know you asked for specific strategies, Paula, and I think the best one is to find an individual mentor. Yes. Email people like Veronica. We so desperately want to help you guys succeed. And so I think, you can attend talks and you can get general advice and you can do all those things, but getting a mentor is the number one best way, because even if they don't have the answers, they know how to find them in a way that a student who's trying to advocate for themselves might not.
Yeah.
Also, sign up for the SAC mentor program.
Yeah. Okay. I was just going to explicitly make the plug for the Student Affairs Committee mentoring program, but Stephanie, nice job on the plug. It's an awesome program, and we really want to, I mean, we're plugging it because it's a valuable program. We're also starting programs, earlier for down the pipeline, like this is an issue that stretches back to undergraduate to high school. So we want to have a sort of systemic change that facilitates this pipeline all the way through. Kathleen.
What I just want to suggest is the idea of no stone unturned. As you interview different places, internship, fellowship, whatever, you may not end up going to that site, but you may interview with somebody that you really connected with. Remember who that person is, stay in touch with them, offer to, do something with them, ask them if there are any committees on this, would you consider me for a spot? Really build your network, because trust me, these people will help you. Two people in the field that I have seen at conferences a million times, and we always sit down and have a chat, I never ever worked with, but I interviewed for fellowship and did not go to their sites. So really do that. And I tell you, when we're on this side of things, we are so happy to pay that forward with other people. So don't underestimate somebody's willingness to connect with you and help you in the field.
Do you anticipate the 2-year time frame for postdoctoral training? Will that change, or do you anticipate keeping the 2 years of a postdoc?
In all likelihood, it'll continue to be 2 years. I mean, one of the challenges, and I think an earlier question alluded to this, is like, there's a lot to do, and we are conscious of that, and we didn't want to extend training even more, right? Like, oh my God, 3-year fellowship, 4-year fellowship? No. We're not going there. But the 2-year is really the standard. And so, and if you think about what we're doing, I do think it's reasonable to say a 2-year fellowship is about right. I mean, just practically, it's about right. So I don't see any, none of us actually see any major changes in that. I think the basic structure of neuropsych training is not changing. This is more sort of digging into the details and how we move forward. So, but those big picture sorts of things, those were hashed out in Houston. And so we're not seeing, that as a change.
What are some of the biggest concerns that have been voiced about the current proposed competencies and guidelines?
What are some of the biggest concerns? Yes, it is. So we're going to put on our best diplomatic hats, and Suzanne's going to start because she is the most she's the most diplomatic of us all. Yep. Yep.
And anyone that knows me knows that is a garbage statement. I would say it falls into a couple of domains. I think the first is the shift to the competency model. I think that was probably the first can of worms that was opened. And I do think it's from people that haven't been teaching. They don't know that we've been there, we've done that, and we've been there for 10 years. But people who are in private practice, who don't train students, are like, what is this wishy-washy language that's not measurable? And I don't understand, like, I need a timeline that goes from A to B to C. And I get that, like, yeah, so that idea of focusing on the end point rather than the nuts and bolts of how to get there, sure. Some controversy there. Unfortunately, there's controversy that the DEI stuff is basically political pandering. That people think that, there is no need for formal training and education in diversity, equity, and inclusion. It's out there. I don't agree with it. And I think that, both personally and professionally, yuck, but it's out there. And so this is kind of the pushback that Doug was referring to. People are like, it goes too far. And I think that's where people say, yes, we need this, but, and that's kind of where it's in the weeds. It's like, okay, this is good, but. So it's clear that when the rubber meets the road, that there's some people who think that what we're doing now is enough. And there's going to be disagreement on that. I don't think we've gotten too much pushback on technology. That's really. Oh, advocacy. Yes, there's lots of that too, because again, that idea of advocacy, they're saying neuropsychologists are not politicians. This is not what we do. And of course, I bring you back to the idea of advocacy as a both macro and micro way of being. Who do we fight for? Do we fight for our profession? Do we fight for our patients? And then at, even thinking federal level, do we fight for reimbursement? Like, yeah, pay me some money. So I think when people think of advocacy, they're thinking of it in a very narrow, pointed way. And, I think there's been pushback on that as well. That's where I'm at. That's as polite as I could be.
That was a remarkably diplomatic answer, Suzanne.
No F-bombs at all.
Not one. We'll just put that on the record. Okay, go attend the town hall if you want to see some. No, we're kidding. So I think that those are like the major themes. I mean, there's been other discussions. Some people want forensic competencies, blah, blah, blah. I mean, it's actually, I do forensic stuff. So I get that. There's a variety of issues. People have different areas. And this happened in Houston, too. Like people have niches and it's like, well, why aren't you covering this niche or that niche? And that's fine. But my opinion, is those aren't foundational or functional competency. To be a neuropsychologist, you don't need to have all this training. If you want to go get extra training in that area, great. Go to a program that emphasizes that. Those options will still be available. Maybe it's forensics, maybe it's epilepsy, maybe it's peds, these aren't meant to be that granular. These are meant to be broad competencies that cover everybody. So anyway, but I think the main themes, I think Suzanne did a really nice job of covering.
I just wanted to add one comment too, as we're talking through it, as somebody that's in fellowship and came from a PsyD program. Just kind of the undertone that a lot of the things to get to where you need to be if you're coming from a non-traditional path is also your own financial burden, and that just being an equity issue. So I was wondering if you had any thoughts on that piece and that burden on the students and or training.
Well, so one thing I can say is, we certainly don't want to increase that burden. And we talked about that in terms of like, we don't want to increase time, to graduation or anything. And I mean, there's also, and I think you raised some issues that, are legitimate issues for our field to be discussing and trying to figure out that are outside of just the competency guidelines per se. And I would say that that's one of them. It's a very fair issue. It's an issue that affects a lot of people. And our goal was really to not exacerbate the situation. But there are other groups working on those sorts of things, but they're complicated. Tony. Yes, Tony, go for it.
Yeah, so this is an issue that's really important to me, as well. And I think some false dichotomies are sometimes set up here. We seem to say that, we can be diverse, but that means we have to then compromise on quality of training. And that is not true. So this is an issue. The equity issue is an issue of our being paid what we're worth. And the reality is we're not paid what we're worth. As a profession, we are not paid what we are worth. Now, is the solution to that to then cut back on training, cut back on our standards? I don't think so. I think the solution is, in fact, advocacy. I think we advocate to be paid for what we're worth, as opposed to compromising our standards.
So in efforts in that area, you really should go thank Neil Pliskin and Tony Puente, because they work like dogs to try and move us along, but it's a long road. Okay, other questions? We have, oh, wow, we're only have 5 minutes. Are there any other last minute questions?
Great questions, you guys. These are really terrific. Great discussion. What would be a good mechanism if more questions come up for students? Is there a way that they can submit questions, or what would you recommend? And then, yeah, anything that you might want to say kind of in closing as we're wrapping up.
So the question is kind of in closing is, if more questions come up, how would students get those communicated? And I'm looking at my colleagues to come up with ideas.
Consulting about this as we speak. So
We're working on it. Stand by.
So a couple of thoughts. I mean, one, in terms of if you have amendments, if you have suggestions about things like this, who's the rep, what's the format? So I'm gonna throw Mary under the bus again. So Mary Fernandez, right. I know that's fine, but you're also a delegate, Mary, and you're also a trainee. And as the AITSN president, you're one of our reps. So I would say, perhaps, in order to get your amendments, you go through your delegates. So I'm pointing to her as one of those people to talk to. There's also ANST delegates, and I'm trying to remember off the top of my head who they are.
I think they're on the website.
Okay, Zach
Zach
Resch,
Resch.
thank you. And I'm trying to, and the other AITSN rep is Megan Kramer. So again, emailing her in order to sort of put things in. In terms of general questions, though, that's kind of where we're struggling, I think.
I have a suggestion.
Reps might, the delegates might be able to answer them again,
That's what I was
because they were there.
Yeah.
And, everybody has the same information. So we were all there. Blah, we all have the same information. Got a little too Italian there.
That's good. And if the delegates can't answer the questions, they know they can contact us.
Contact us.
Yeah.
So I think there's lots of people out there. Send them an email. And if your questions aren't answered, they will come to us.
Okay.
And
Oh,
I was gonna say, and Shafali Singh is the other ants rep as well.
there you go. And I thought I was good at volunteering people.
No.
Well done, Suzanne.
Mary is my doctoral student. I get to do
Yeah.
this.
Sorry, Mary. Anyway, I hope that helps. So, so reach out to delegates. They will probably be able to answer almost all of your questions. But if you have others, they'll reach out to us and communicate. And so you probably know, I mean, in July, we're going to be meeting, with all the amendments and all that sort of stuff. So we'll keep the field posted on the progress and everything like that. And we hope here to get those guidelines in final form and published. They'll be published in TCN and archives when they're all finished. And then there'll also be some supplemental papers that will kind of describe more of the process and everything with that. So look forward to that as well. I think there was one other hand up. Sure.
So the guidelines are going to be published before the nuts and bolts are there, or are they going to be published together? Because that is one concern about having, this is where we're going, but I don't know how we're getting there. I did have that question about the publication, if it would be all together.
So the answer was there'll be a single issue published together.
Great
Okay.
question.
Yeah. All right. Well, I this went really fast. I think we're just about out of time. Thank you for coming and thank you for all the awesome questions. And it was really, really great to have you here. So appreciate it. Thank you, everybody.